Hello everyone, Namaskar. I am Dr. Deepak Sharma, General Secretary of Delhi Homeopathic Medical Association and Executive Director of Homeopathic World Community. Welcomes you all in this joint venture of both organizations. This is not the first. This is the second time for this organization are doing work to promote homeopathy together. I welcome each and every one here in 117th webinar of Delhi Homeopathic Medical Association. And as per rule of DHMA, I request to our patron, Dr. VP Singh, to welcome all the members and give permission to start this session. Dr. VP Singh, sir. Hello everyone, Namaskar. I am Dr. Deepak Sharma, General Secretary of Delhi Homeopathic Medical Association and Executive Director of Homeopathic World Community. Welcomes you all in this joint venture of both organizations. This is not the first. Dr. VP Singh, sir. Dr. VP Singh, sir, please unmute yourself.
Today, I, Dr. VP Singh, in the capacity of patron of Delhi Homeopathic Medical Association, express my gratitude on this auspicious occasion of an international webinar, joint venture of Delhi Homeopathic Medical Association and Homeopathy World Community, organized, hosted by Dr. Deepak Sharma, and UTA Mittelstadt, with ever of Dr. Deepak Singh, along with untied effort of the Executive Committee of the Homeopathic Medical Association. Now it is my privilege to heartily welcome to our learned speaker, Dr. Hannah Shalom. She will give us vast knowledge about the prostate cancer, and with knowledge, well-known personality in homeopathic fraternity, Dr. Hiralal H Agarwal, will speak on liver cancer. It's my pleasure to know that more than 600 audience and are participating in this webinar. I again welcome to all of you. Thank you, Dr. Deepak Sharma.
Thank you, sir, and thank you, Dr. VP Singh, sir. On behalf of the President of Association, unfortunately, he is not there, but I welcome Marilyn Shannon, who is the CEO of Homeopathy World Community. Hello, Marilyn. And Uta is there, who is the CEO of Homeopathy World Community. Hello, Uta.
Hello there. How are you today? Everybody is here. I'm excited to see everybody here today. Thank you very much, Dr. Deepak, for this fabulous opportunity to collaborate on this webinar with the DHMA. As an integral part of both organizations, you're the highly esteemed executive director of HWC as well. So we're very happy to be here today. Now, for those of you that don't know HWC is the Homeopathy World Community. We're a global community and a portal for practicing homeopaths, patients, and members of the public interested in the homeopathic treatment approach. We educate professionals and the worldwide public interested in learning about homeopathy and over a large range of courses, webinars, and events. Now, we're very happy to contribute a fabulous speaker to today's webinar. We're looking forward to hearing and learning from the experiences and the wisdom in practice in the treatment of cancer from both these very esteemed speakers and homeopaths that are with us today. So thank you, Dr. Hira, for presenting in this collaboration with us today. I'm very happy to see you again. And presenting on behalf of HWC is Hannah Shalom. She's the Director of Education at HWC, a homeopath based out of Toronto, Canada, and also my partner in crime occasionally when we host HWC events together, such as the Virtual Coffee, Spiritual Wellness Circle, or Practitioner Supervision. I'm looking forward to the webinar, and I hope you as the audience find this very informative as well. Thank you.
Thank you. Thank you, Uta. And it is my pleasure to represent the both organizations on this platform. So welcome everyone. Here, those are new to DHMA and SWC. Uta is already explained about the SWC, and I am just sharing a few minute slide about Delhi Homeopathic Medical Association. Delhi Homeopathic Medical Association is the oldest organization in Delhi, India, and it is established in 1932 by Dr. Yudhvir Singh. Dr. Yudhvir Singh, sir, is the first health minister of Delhi government, and he founded the Delhi Public Library, Nehru Homeopathic Medical College, and many homeopathic dispensaries in Delhi, India. DHMA is the 89-year-old now, and since then, and we are completing their CMEs, health camps, research work, student supports, and government projects. We are doing here with the help of Delhi Homeopathic Medical Association and its member. Now, today is the Homeopathic World Community and DHMA collaboration, but it was not the first, it is the second. The first was on the 8th of August 2018 in the physical meeting in New Delhi. And there was the picture of that seminar in a hall in Delhi, and Dr. Kavita Kokunor was the president at that time. So today is the second venture of these two organizations. Now, DHMA in 2021, there are 17 executive members, 285 registered homeopaths are there, more than 160 registered students, more than 100 registered associate members, and 10 life members are there. DHMA is promoting research work, especially for the COVID and post-COVID COVID cases. More than 115. Today is the 117th webinar, and of more than 250 hours since 28th March of 2020 after coming to the COVID. Now, DHMA is planning to publish Hanimanian Sandesh. Sandesh means the message. This will be go online very soon. Previously prevented many issues on the physical basis. Now associate with many international organizations, planning health camps in developing countries also. More why you want to choose DHMA? This is more than 300 peer-reviewed articles will be soon available for members. DHMA members, WhatsApp and Telegram group for members, especially case discussions with senior homeopaths, opportunity to meet with stalwarts, free joining in every activity of DHMA. You publish your article or blogs on priority basis. Connect to the international homeopathy in just a click. This is the reason why you want to join DHMA, and this is all similar about the SWC also. Now today on 12th of September, we have 1.1K subscriber on YouTube, 31 followers on Twitter, and 4410 followers on our Facebook page, and 502 followers on our Instagram page, and Delhi Homeopathic Medical Association is always there. Now, for any query, you can ask about DHMA or SWC to me, Dr. Deepak Sharma. My phone number is 91 is code for India, and 9711153617 is my WhatsApp or Telegram number. You can also log into www.dhma.in or email us at dhmadelhi@gmail.com or WhatsApp me at 9711153617. Thank you so much. This is all about DHMA, and Uta, thank you so much for introducing SWC also. Now, we have our speakers today, and Hannah, you are the first. Now, Hannah is a classical homeopath with training in business development. She is a leadership professional coaching, Western medicine, homeopathic medicine, kinesiology, nutrition and herbology. She is DCHM honors in and FCHM. She is a registered homeopath, RS Home and North America, and Director of Education of Homeopath World Community. We welcome her to for giving her valuable lecture today on cancer, especially on the prostate cancer. So welcome, Hannah. Thank you so much, and please continue with your slides. You are just a co-host, and you can share your slide. Thank you.
Thank you so much, everyone, for allowing me this opportunity to be here. Welcome, everyone. Hello, good morning, good evening, from just about any part of the world you're at. I will share my screen sharing in just 1 second. Can everybody see?
No.
No. Okay, 1 second, and there will be a.
Hannah, please share it again.
Yes.
Yes.
Can we see that now?
Yes. Wonderful. Debbie is here.
Excellent. Thank you so much. I would like to take the opportunity to mention Homeopathy World Community and the founder, Debbie Brooke. She's creating the waves of awareness, even she's no longer with us. A special thank you to Marilyn Shannon for undertaking this organization. And thank you so much to Uta Mittelstadt, my partner in crime, and fantastic homeopath and a leading example in just about any way, shape, and form. Today, we're going to present about the prostate cancer. And again, thank you so much for allowing me this opportunity to be here. In my opinion, here in North America, especially, I am based in Toronto and in Los Angeles. Majority of our patients will at first go and seek allopathic treatments. Very often the choice for patients to come into homeopath is absolutely the last resort. A little bit about me. I am the Director of Education at Homeopathy World Community. I am also the founder of Homeopathic Research Institute, as well as the clinic Homeopathic Family Practice. So what is cancer really quickly? I understand we have a time constriction, so I will try to fly through the allopathic settlement before I get into homeopathy. Let's speak a little bit about cancer to understand what's happening. So what is the definition? Why does a body doesn't throw out the damaged cells? What are the differences between normal cells, etc. So let's start. What are the cancer cells? We know that they're changing the DNA sequence, and according to National Cancer Institute and the disease, the body cells grow uncontrollably and they spread over all parts of the body. There is a normal and abnormal cells. We can see here dividing a breast cancer cell, which is actually a phenomenal. Sometimes the cells signal an errors and cause a damage by DNA, and those harmful environmental substances such as chemicals, tobacco, smoke, poisonous chemicals, etc., tend to increase the cell division. Why our body doesn't throw out the cells damaged by DNA? Generally speaking, by natural elimination, our body throw them out before they become cancerous. However, the chromosome changes in a DNA tends to foster the cancer cells. Let's look into what are normal cells, differences between normal and cancerous cells. So normal cells grow when they receive a growth signal. They stop growing when they receive a stop signal. Most cells don't move around the body. Your immune system is really responsible for elimination of damaged and abnormal cells, etc. When cell become a cancerous, the growth is the absence of the growth signals. So all the signaling coming in from the brain, telling to the cells stop dividing, stop growing, and diapoptosis is no longer in place. We're looking into a lot of duplicate and delete chromosome parts, altering proto-octogenics, tumor suppressors genes, and DNA repair genes are no longer in place. All tissue changes not all tissue changes leads to cancer. We can see here a fairly normal cell, hyperplasia, dysplasia, and cancer. Normal cells may become cancer cells, but they don't always do. Hyperplasia, dysplasia may or may not become a cancer. What are the main types of cancer? So let's speak here for a moment. We know about carcinomas, which are the most common types of cancer. They are made of epithelial cells. Sarcomas, which are cancers that are formed mainly in the bones and soft tissues, and leukemias, which are benign, begin in a blood-forming tissue. Let's just underline that carcinomas are adenocarcinoma forms in epithelial cells that produce fluids or mucus and includes cancers in a breast, colon, and prostate. And that is really important in here because we are speaking about the prostate cancer. Lymphoma, cancer begins in lymphocytes. Multiple myeloma, all cancer starts in a plasma cells. Melanoma begins in the cells that form melanin, and cancer of the brain or spinal cord is when usually tumors are first formed. So let's get into our topic today. What are the prostate glands? What is the structure of the prostate? And what are the tissue changes and abnormalities, and do they lead to a cancer? So the prostatic glands, let's talk about prostate. It comes in from the Greek word, means guardian or protector. And the prostate gland is found in a male reproductive system, and it's about the size and the shape of a walnut. Its function is to secrete a milky white, slightly alkaline prostatic fluid, which constitutes about 30% of semen. We know that alkalinity is very important because it helps to neutralize the acidity of the vagina, so it will increase the lifespan of the sperm for fertilization. The seminal vesicles are glands found on each side of the prostate, and they make most of the fluid in semen. The structure is really, I think it's really amazing. Upper part of the prostate is called the base. You have also prostate that is divided into two lobes, right and left side, and that makes up of branching ducts surrounding to the stroma. The cells lining in the duct make prostatic fluid and is mixed with sperm and other fluids to make a semen. The base of the prostate is covered by the thin layer connective tissue called the capsule. So the apex of the prostate is covered by the anterior fibromuscular stroma, which is made up of muscle fibers and connective tissue. And this is very important to understand, especially when you have different types of cancer starting in the different parts of the prostate. Prostate has zones, peripheral zone, which is the largest area of the prostate, and most prostate cancers starts right here in the peripheral area. The transition zone is surrounding the part of the urethra, and that passes through the prostate. This zone grows as men age, and the condition is called benign prostatic hyperplasia. You have central zone that lies behind the transition zone and surrounds the ejaculatory ducts, and it's very few prostate cancers begin in that area, as well as you have the anterior fibromuscular stroma. So that's a thickened area surrounding the apex of the prostate, and you have a very rare occurrence of a cancer found in that area. So not all swelling, not all pain or issues with urination leads to cancer. So let's take a look at non-cancerous conditions of the prostate. We're looking into prostatic PIN, prostatic intraepithelial neoplasia, and this is abnormal condition of the epithelial cells that line in the glands of the prostate, and it can take effect more than one area of the prostate. We're looking at ASAP, which is atypical small acinar perforation. This is an abnormal growth of cells in the prostate and may lead to cancer. We're looking at PIA, which is proliferative inflammatory atrophy, and that means those are areas of inflammation in the prostate, and the cells look a little bit smaller than usual. We will discuss it a little bit further. We're looking at prostatitis, which is a painful inflammation of the prostate, and essentially very often patients are being sent in for biopsy in order to understand or diagnose or examine the reason of the pain and inflammation. We have 4 types of prostatitis: acute bacterial prostatitis, which is caused by bacteria, and symptoms may suddenly be sudden and severe; chronic bacterial prostatitis, which is caused by a bacteria that is often lasts for several months. Symptoms such as burning, pain, urination come in and go, appear on and off with men with benign prostatic hyperplasia. We also have here a chronic non-bacterial prostatitis and chronic pelvic pain syndrome. Those two go together, so it's a concomitant symptom in the repertory. And it's a chronic condition, most common type of prostatitis, and it's caused by intermittent pain and discomfort in pelvis. Of course, we have asymptomatic inflammatory prostatitis, and that has no symptoms. There is just white blood cells in the prostate or prostatic fluid. It may be diagnosed when usually looking at the testing or looking for different conditions. We're going to have a case of asymptomatic inflammatory prostatitis later, and that was found during a yearly physical. The risk and factors of prostatitis are really important here as well. Infection from bacteria, viruses, and fungi, STDs, muscle spasms of the bladder, history of UTI, muscle spasm in ejaculatory duct, and trauma that causes inflammation with nerve damage into the pelvis. And we can see here that the prostate is quite normal, and we can also see the inflammation in the prostate. That inflammation will cause the narrowing of the urinary duct and also a pain. Let's look on signs and symptoms of prostatitis. So definitely blood in the urine of semen, burning or pain during urination, difficulty with painful ejaculation, pain and pressure in the rectum. The needing to urinate frequently is one of the first symptoms that very often patients come in with. Trouble passing urine, fever, chills, muscle aches, sexual problems, a loss of sex drives, etc. The treatment of prostatitis, conventional medicine, is antibiotics, alpha blockers to relax muscles near the prostate, to relieve the pressure of the urethra, muscle relaxants to lessen bladder contractions and reduce urine leakage, catheter through the urethra to open up the urine flow, and herbal therapy using quercetin and ceridine, which can reduce inflammation. So let's talk about BPH, is the enlargement of the prostate caused by an overgrowth of cells. Usually it is fairly prevalent with men over the age of 70, and the risk factors are really interesting. Age and abdominal obesity, lack of adequate physical activity is one of the highest risk factors. What are the symptoms? Again, back to difficulty passing urine, urinary frequency, urinary urgency, weak or slow urine stream, incontinence, blood in the urine, and unable to completely empty bladder, leading to urinary infections and bladder stones very often. The treatment for BPH is mainly diuretic drugs, decongestant, antihistamine, antidepressants, a resin stem treatment, and a surgery. As the resin stem treatment is fairly popular, especially in Los Angeles. I have quite a bit of patients in there using this treatment. It's minimally invasive, and of course they come to homeopathy, but we'll get to that point later. It's a short-term result shows that have a good outcome for patients at the beginning, preserving their sexual function. Surgery is another element when they do. I'm sorry, I think we skipped some. No, we didn't. Okay, so surgery is another element where is being commonly used in Western medicine. Resection of the prostate, laser prostatectomy, incisions of the transuteral incisions, transuteral electrovaporization, prostatic uteral, and prostatectomy. So the definition and description of the prostate cancer, and I think this is when we go in for the most important information. What exactly prostate cancer is, I have a little video, but due to lack of time, I will skip on playing this animation. Let's talk about adenocarcinoma, most common at 95% of all prostate cancers. We also looking into rarer forms of prostate cancers as of urothelial carcinoma, sarcoma, small cell carcinoma, neuroendocrine tumors, carcinoid tumors, and squamous cell carcinoma, which are very, very rare. The prostate cancer, mainly adenocarcinoma, Adena means gland, and carcinoma means cancer. So the tissue affected are part of a larger tissue category, and we can see those changes right in here. Epithelial tissue line skin, glands, cavities, and organs. Malignant adenocarcinoma invade other tissues, and it's often metastasized. Prostate cancer, urolithial carcinoma. So this is a cancer of the bladder that invades the prostate glands. Very often, patient will be diagnosed often with a bladder cancer, and if it's not being cut in place or quick enough, it tends to turn into a secondary cancer, which will be a prostate. Sarcomas are rare cancers that can develop anywhere in the body, including the prostate. Unlike common prostate cancer, sarcomas do not develop from cells that line the prostate. So it's not, so it's a granular epithelial cells. Instead of, they develop in the smooth muscle cells in the prostate called mesenchymal cells. And you can see right here how the structure of the cells changes. Small cell carcinoma is undifferentiated neoplasm composed of primitive appearing cells that are smaller than normal. It is rare malignancy that is considered a lethal entity of the prostate cancer. And neuroendocrine is a very aggressive variant of a prostate cancer that may arise in a new place or in a patient previously treated with hormonal therapies for prostate adenocarcinoma as a mechanism of resistance. Carcinoid tumors of the prostate are defined as well as differentiated neuroendocrine tumors with limited or no association to principal components. In other words, is the PSA as the first diagnostics showing us that the numbers are elevating is totally negative. So the PSA is normal. And squamous cell carcinoma, very rare, makes up from 0.5 to 1% of all prostate carcinomas. And presenting symptoms range from obstructive lower urinary tract to bony metastasis. It's essentially through Western medicine, the time span is given to a patient approximately 14 months without any treatment. So what are the risk factors? Let's talk about that, because I think it's very important, especially for men, all our men that we have here today online. So the risk factors are, it means likelihood someone can or is able to develop cancer. We're looking at age, we're looking at family history of the prostate cancer. We know that African-American men has higher occurrence of prostate cancer, obesity, men that are tall, diet high in processed foods, dairy, calcium, low levels of vitamin E and selenium, inherited gene mutation. So we will discuss BRCA1 and BRCA2, smoking tobacco, high level of androgens and prostatitis, and then working with pesticides, cadmium, and chemicals used very often in rubber manufacturing. The occurrence of prostate prostate cancer in the world in 2018 had over 1.2 million new cases. We're looking at North America for 73.7%, Europe at 62.1%, and Oceania at 79.1%. According to American Cancer Society, we estimate around 200,000 new prostate cancer patients for 2021. Here are some top 20 countries ranked in incidence of the prostate cancer as of 2018. Guadeloupe in France, Martinique in France, Ireland, Barbados, Estonia, Norway, Sweden, Puerto Rico, and France again, New Caledonia, France. So I guess we suffer from lots of occurrences of prostate cancer. Let's look in at what percentage of men will get prostate cancer ever. So in 2020, it's been estimated that on average, 11 Canadian men will die from prostate cancer every single day, and 64 Canadian men will be diagnosed with prostate cancer on a daily basis. Those statistics are really interesting to view. So let's go into symptoms of prostate cancer. Increased urinary frequency at night, urinary urgency, straining to start urine flow, weakened slow urine stream, interrupted urine stream, leakage and dribbling, difficulty controlling bladder, so incontinence, weakness or numbness in legs and feet, burning pain, especially during urination, painful ejaculation, erectile dysfunction, loss in sexual desires, blood in urine, blood in semen, shortness of breath actually, and pain and stiffness in hip, back, chest, and pelvis. Generally, general procedures to discover anything that's going on with the prostate is one, examination, so rectal examination when the physician feels the prostate for hard and lumpy areas, ultrasound, PSA test. There is one of best assessment tools of PSA for a prostate-specific antigen. Of course, biopsy remove the tissue from 12 core sectors. Sometimes bone scan or CT scan or MRI may be done as well. Here in North America, MRI is being often referred to. So steps to diagnosis, we're looking at the history, testing, especially we want to make a remark of a sign of Gleason number, outline treatment choices, and that's, we're talking about Western medicine. I often combine Western medicine with homeopathy as my patient. Again, first or previously went into a Western medicine route, and PSA numbers that are very important, biopsy core, samples, and the results for us to be presented if the patients can bring them in. Let's talk for a moment about the Glycine Scale. Since prostate tumors are very often made up of cancerous cells that have different grades. It essentially it's two grades to assign for each patient. The primary grade is given to describe the cells that make up the largest area of the tumor, and the secondary grade is given to describe the cells of the next largest area. So for instance, if Gleason score was written 3+4=7, means that the tumor is grade 3 and the next largest area section of the tumor is grade 4. Here is the Gleason pattern scale for those who are not familiar with this. It's been used very frequently and again in all prostate cancer cases. So stages of cancer, stage 1, cancer cells are growing in the prostate but haven't yet spread beyond, and the tumor is half or less than half of the prostate. It's a localized prostate cancer. Stage 2 cancer has stayed within the prostate, but the tumor is able to touch more than half of the lobe of the prostate. Stage 3 is the stage of the cancer that has spread outside of the prostate. Especially we're looking into lymph nodes. And stage 4 are the cancer that spreads to nearby lymph nodes, but may also spread to distant organs, spreading whatever is stage 4A or 4B. That will allow us to understand the state of a patient. And this stage is called as advanced prostate cancer or metastatic prostate cancer. So existing medical treatments and protocols, this is again in North America very prevalent, the same as Europe. Homeopathy is really not the first choice, unfortunately, for a lot of patients. So let's look in step 1 is wait and watch. And again, you'll see in my case presented, that was the approach with Western medicine, a physician who suggested a wait and watch approach. Step 2 is advanced surveillance, so the doctor checks regularly for changes in a condition. Step 3 often is being prescribed as radiation, and it's usually subsequent option to involve surgery. The side effects of radiation are breast swelling, bone thinning, weight gain, hot flashes, erection problem, lower sex drive, mood swings, and heart disease. And I am mentioning again all Western medicine treatments for prostate cancer, because when you have complex case of a patient who have been through already Western medicine treatments, a lot of symptoms are being either suppressed or a lot of symptoms are being provoked by a treatment. So those symptomology aren't always very organic. The medical treatment for prostate cancer continuation, the side effects will increase urinary urgency, difficult or painful urination, bladder inflammation, narrowing of the rectum or urethra, very painful bowel movements, rectal bleeding, inflammations, rectal leakage, fatigue, a lot of skin rashes, very similar to sunburn, especially post-radiation, and secondary cancer in the region of radiation. Of course, we can mention suppressed immune system. Brachytherapy is a therapy where a sealed radiation source is placed inside or next to the area of requiring treatment. We also often refer to a patient as patient is radiating. Surgery is the step 5, removes the whole prostate and some tissue surrounding areas, and you can see how damaging that might be, but if it's necessary, it's unnecessary. So types of surgery, we have open radical retropubic prostatectomy. There is evidence, if there is evidence that the cancer has spread to nearby lymph nodes, there's some areas are also removed and sent into a lab. This actually, it's unlikely that this surgery can cure cancer. It's by removing the prostate could lead to a serious side effects. Robotic surgery is assisted laparoscopy radical retropubic prostatectomy. Again, it's very advanced and over open radical prostatectomy, including less blood loss, less pain, shorter hospital stays, faster recovery. The next one is open radical perineal prostatectomy. So this method is not really appropriate if the lymph nodes needs to be removed and often leads to erection problem, especially very difficult with patients who are younger and being affected by not only prostate cancer, but also by the family situation, or if they wanted to procreate. Let's look at transuteral resection of the prostate, and the surgery is usually done for benign prostatic hyperplasia. It's very popular actually. Surgeon removes the inner part of the prostate gland that surrounds the urethra using retroscope, pass through the tip of the penis into the urethra and up to the prostate. It's usually cut and vaporize the tissue. HIFU, it's one of the most popular treatment currently on the market in Western medicine. And it's essentially ultrasound probe insert into the rectum with high intensity beam that hits the target prostatic tissue to a high temperature, destroying it. Unlike radiation, HIFU is non-invasive. Treatment takes about 2 hours. The Cleveland Clinic offers HIFU treatments in Toronto, in the US. Quite a lot of complications and side effects post this treatment. We see return of the prostate cancer as one of them. A lot of prostate infections, a lot of UTIs, incontinence, and burning sensation and urinary retention. Another type of prostatic surgery is thermal ablation using laser. The laser fiber is placed into the tumor and is activated to being heated, and by heating the tumor using MRI images to show and monitor the temperatures. The lesions are often the issue. And a laser prostate surgery done by laser. Again, potential side effects after surgery are temporary difficulty urinating, UTIs due to catheter placed, a lot of antibiotics treatment, post-infections, narrowing of the urethra, and a lot of scar after prostate surgery can block a urine flow, dry orgasm. which is actually very common with all patients who have been through Western course. It's dry orgasm is known as a retrograde ejaculation. It's not harmful, but it definitely affects sexual activities and can interfere with the ability to procreate, again, especially with younger patients. ED, erectile dysfunction, and need for further treatment. In patients when radiation hasn't worked and the cancer has recurred or persisted in the prostate without spreading, removing the prostate in a procedure called salvage prostatectomy, and it's potentially curative. But again, we think we can discuss the word curative in many ways than one. The risks of surgeries, again, hot flashes, weight gain, loss of muscles, vomiting, hair loss, reaction to anesthesia, bleeding from surgery, blood clots in legs, lungs, and damage to nearby organs. What is interesting, the most important success factor in any surgical methods is the surgeon's experience and skill. The research, what's happening in alternative medicine, this I will skip real quick. Anti-plastron therapy for Dr. Bozinski, it's a privilege and pleasure to know him and work with him and learn from him. He's created himself a name for very innovative type of therapy, very successful with glioblastoma and aggressive brain cancers. But in his trial study stage 3 and 4 prostate cancer were successfully attempted. The potential side effects from this therapy include anemia, nausea, vomiting, dizziness, anorexia, fever, chills, stiff joints, high blood pressure, gas, seizures, etc. Another alternative treatment is cryotherapy ablation. So that is used as cold temperature can kill prostate cancer. Doctor may recommend this approach for localized cancer or its radiation if radiation didn't work. The side effects are quite interesting. Cryotherapy destroys tissues that it touches, so both cancerous and healthy. This is usually a one-time procedure and it's done for a few hours at the specialist's office. A lot of side effects include blood in urine, a soreness in the area when the needle is placed, loss of urinary control, so incontinence, injury to the rectum, and loss of sexual function. Another alternative treatment is immunotherapy. It treats the whole body, attempting to activate person's immune system that will destroy any prostate cancer cell within the body. And instead of attacking cancer cells directly, immunotherapy helps the body to fight cancer. So it uses materials either made by the body or in a lab to improve target and to restore immune function. This is a really interesting therapy called monoclonal antibodies. Humanized mice is being immunized, antigens being developed, isolate, antibodies are forming cells, and those cells are being extracted from humanized mice, inject into the tumor cells. And hydromass screening for the production of desired antibody. Those antibodies are producing hydromass, which are cloned, and that gives the monoclonal antibodies. I have not met one person who have used or been treated with this therapy. And Provence, as an immunotherapy vaccine, is a company called Dendrion created a drug called Provence, and that's essentially it is a vaccine treatment used in men with advanced metastatic hormone resistance, asymptomatic prostate cancer. So the white blood cells are extracted from the patient, sent into the company facility where they are being activated to program T cells to destroy the prostate cancer. And very common side effects are flu-like symptoms that last for about 24 hours. IMX, immune modulation therapy. So that combines a variety of immunotherapies around the world using genetic information from your circulating tumor cells to target your cancerous tumors with dendritic and natural killer cells in combination with lab-created viruses. And CIPI is a chemoimmunotherapy. Again, it's injectable, and this therapy addresses BRCA genes and tumor suppressing genes when they mutate. So they can cause prostate and other cancers. Men with mutated BRCA2 gene are 7 times more likely to develop prostate cancer than in the general population. And this is why knowing family history is very important, or testing for BRCA genetics are crucial. We know in women, BRCA1, BRCA2 leads to increased breast and ovarian and cervical cancer, and men leads to a prostate cancer. And homeopathy, oh my God, we arrived, I'm so happy. So let's take a look at Organon, which aphorism is responsible for what and guiding us through the maze of homeopathy. We also know that the general cardinal principles of homeopathy is the law of similar, law of simplex, law of minimum, the doctrine of drugs, drug proving, theory of chronic diseases, theory of vital force, and doctrine of drug dynamization. Always pay attention to the totality of the symptoms. Each symptom must be complete with regards to location, cessation, modality, and any concomitant symptoms if we have in a case. The past history is crucial, family history is crucial, it's fundamental. We have to understand the essence of emotional behavior of the patient. To give an example, like a podiums or generally teachers, doctors, successful dictators, politicians, and they are Mr. Safe. Their personality characteristic reflects their timid, egoistic, careful, often hypocrite, etc. Let's take a look at Nox Vomica. A lot of CEOs, a lot of salesmen, financial wizards, investment brokers, very ambitious, impatient, sometimes arrogant, very charismatic, fairly aggressive, very independent and confident, workaholics, and perfectionists. Let's take a look at Mr. Pulsatilla, babysitter, nanny, nursery, teacher, nonce in a church, social workers, very emotionally tearful, changeable mood, pleasing, perceptive, affectionate, caring, forsaken, and worries most of the time. So I want to also remind everyone from our first 91 on, we're talking about concomitant symptoms often caused by allopathic drugs. So the picture might not necessarily be clear and organic. And so the symptoms, and I will read that out loud, our first 91, the symptoms and feeling of the patient during a previous course of medicine do not furnish the pure picture of the disease. But on the other hand, those are symptoms and ailments which he suffered from before he used of the medicine or after they had been discontinued for several days. Give the fundamental idea of the original form of the disease, and those especially the physician must take note of. When the disease is a chronic character and the patient has been taking medicine up to the time he's seen, the physician may with advantage leave him some days quiet without the medicine, or in the meantime administer something, go on ad medicinal nature, and defer to a subsequent period the more precise scrutiny of the morbid symptom in order to be able to grasp if their purity, the permanent uncontaminated symptoms of the old affection, and to form a faithful picture of the disease. Again, a lot of symptoms our patients are unable to catch in time, or they just don't pay attention. Life is too busy and so is work. A lot of symptomology goes by until it becomes already uncomfortable. So we have a case here of asymptomatic prostate cancer. Due to limitation of the amount of slides I was able to put into this presentation, some of the information I will just translate verbally. This is a 50-year-old male with enlarged prostate, asymptomatic. He spent the last 2 years between doctors, MRIs, biopsies, and endless ultrasounds and exams. So let's take a look at this patient. His father was diagnosed with a prostate cancer at the age of 50, high blood pressure since the age of 40. Mother has suffered high blood pressure, diabetes, anxiety since early 30s, which parents divorced. The grandfather suffered from enlarged prostate, passed away from cancer, and no one knows what kind. Grandmother had diabetes, high blood pressure, lived until late 90s. Brother, age 55, with autism spectrum, institutionalized with a lot of health problems. I will mention that this patient is, origin is Mediterranean, and so he suffers from thalassemia. He have ailments from disappointed love, long-standing silent grief, of very unhappy relationships, a lot of suppressed emotions, barely opens up about it. His father passed away suddenly without saying goodbye. That caused a massive trauma, high stress, the very demanding job, anxiety about health, enlarged prostate, 4 times the size. He's overweight, 300 pounds, always struggle with weight. He wakes up 3 to 5 times per night to urinate. And since the last 2 years, he dribbles after urination, doesn't feel empty for the past month. His enlarged prostate was found due to yearly physical. The PSA number was at 20, I think 20.4 to be exact. Had 2 MRIs showing absolutely nothing, 3 rectal exams, and ultrasounds showing only enlarged prostate. The doctor decided to give him, schedule him for biopsy. Everything came back normal. There is no white cells, no abnormal cells. Everything's perfectly smooth. The doctors told him, you are a large man and your prostate is also large. So we have to wait and observe until something happens. He lives alone, loves to cook and eat. He came not believing in homeopathy whatsoever, but willing to try. He used to be very angry, controlling. Now is controlling anger by walking away from situations. He used to be very explosive. Doesn't tolerate when someone is contradicting him in any way, shape, and form. He's not listening to him. He got into a little rage. But again, now he tried to control by walking away. He cut off family and friends during the week because he doesn't really want to hear from them. To lessen the amount of stress, he desires to be alone. He started to go on a gluten-free and dairy-free organic diet. He desires, he loves sweets, so he loves donuts, cakes, cookies. Essentially, he had a very difficult time to stop eating it. He craves and loves coffee. He recently gave up coffee, but he still loves it. He drinks about 3 liters of room temp water. He does drink icy water, but only in the summer. He goes to sleep at midnight, wake up 5 or 6 in the morning. That's his schedule. Lately wakes up with anxiety. He can't stay long in bed, could not stay in bed long since he was a little boy. He loves to watch TV. He's always fatigue tired, forcing himself to exercise. He lost about 100 pounds in 1 year and walking about 10 kilometers per day. He swears a lot, seems to be very arrogant. First conversation with him via phone was, I don't give a fly. They went up my beep. Very angry with whole entire Western medicine treatment. So here are some numbers. Serum protein for C-reactive protein 6.7. We know that this is an inflammatory response. His tumor marker is at 20.3. And his vitamin D is actually phenomenal at 209. We're usually looking into vitamin D deficiency, especially with cancer. But we can see his hematology as a little bit off-sided and showing mild anemia and active thalassemia. However, his ferritin level is at 338, and I'm not sure if you can see this here on the bottom of the screen. This is very alarming. We're looking into repertorization, Lycopodium, Staph aureus, Vomica, sulfur, sepia, etc. came in to a forefront. We're looking at just the prostate cancer, just the prostate repertorization, where Tuya came into picture. With the selection remedy, I decided to give him a call, ask him a few questions. I asked him if there's anything else he would like to share with me. He said he wakes up with anxiety. He used to wake up hungry, and he doesn't know if he has anxiety from hunger or anxiety from the state of his health. He sleeps on the right side. He can't fall asleep otherwise. He used to be very sexually liberated, but all his adventures fell through real quick. He loves silence in the morning, and if anyone is around, he becomes very irritable and groggy. He fills up quick, so he doesn't eat much anymore, and he used to be very windy, but since he changed his diet and took out dairy and gluten, that wind kind of went away. He always worried about his liver because he was so overweight. Second repertorization, again, Lycopodium came to forefront, and on aphorism 102, in the course of writing down symptoms, several cases in this kind of sketch of the disease, picture becomes ever more and more complete. Do not be strewn and verbose, but more significant, more characteristic, and including more of the peculiarities of the collective disease. So we definitely looked into the malady of his case. My remedy choice were Lycopodium 30C, 2 times a daily in water potency. 3 weeks follow-up, he wasn't so angry. He was okay without sweets. He doesn't crave them anymore. He sleeps through night, wakes up only 1 time to pee. He doesn't know why, but he's feeling better. I decided to make no changes in this remedy. He came back 3 weeks later and said, I have a lot of energy. It's easier to relax. Actually, I started taking weekends for myself. I don't worry so much anymore. I know I will be okay. I don't feel pressure anymore. And that was not reported symptom. Another no changes into his remedy, and I asked to redo a blood work to see the PSA, and yet have to see the patient in next week. Another case is asymptomatic prostate cancer, 84-year-old man, enlarged prostate, asymptomatic blood work with very high PSA numbers, tumor markers of 39. I referred the patient to another physician for further testing. 2 weeks later, came back with the diagnosis of very aggressive adenocarcinoma. Again, here I'm showing you numbers of a prostate PSA at 38.5, but what's interesting is antigen at 42. We had done the tumor markers with the previous patient, but his cancer antigens came back normal. So let's take a look at the history of this patient. He doesn't remember much of his family history at 84. He never really paid attention much. It's a post-war child. Didn't really pay attention much to health or to life or to parents. Needed to recover. They immigrated to Canada from England, and so he was diagnosed with diabetes at 39, had a hernia surgery at 43, heart attack 55, pacemaker 59, allergies to pollen and mold, and sudden vision loss at the age of 82. What part you don't know in here, again, I didn't get an opportunity to put it in. This is my patient who I have treated for 5 years and I haven't seen for 3. This patient originally came in with swelling in the legs and psoriasis. So the symptoms present, I haven't seen them for 2 years. He just came back and asked, his symptoms are ailments from disappointed love, unexpected anger, unexplained anger. So a lot of suppressed emotions due to his history, the first marriage, a loss of that relationship and not having contact with the children from his first marriage. From his second marriage, there is a child that is not his biologically, but allows him to feel very emotionally content as a father. He has diabetes, swollen legs, not as much as years earlier, but the swelling come and go. to his report, he's no longer wearing his oppressive compression socks as often as he used to. He masturbates occasionally, so there is still a desire for sexual activities. In a food department, he couldn't care what he eats. He loves his cookies and wine. He sleeps quickly and wakes up early at 6, 7 a.m., has his breakfast. He doesn't pay attention to dreams. If he has them, he doesn't remember. Bowel movement is normal. Urination, having pressure, but can't really go. Dribble a lot when he's going, and had incontinence. Perspiration, profuse, especially at night. And wife came in saying he's very stubborn. He gets angry easily. He doesn't listen to me anymore. He's fighting for cookies and cheese and wine. He doesn't tell her anything. He is very depressed and she's worried about him. Between me seeing him first time and his blood work and sending him to a specialist, and when I see him the second time, he was put on Firmagon, and Firmagon are prostate cancer injections. They belong to class drugs called gonadotrophin released hormones. So it works by stopping testosterone production. So aphorism 98, very important. Now, certainly we should all listen particularly to the patient's description of his suffering and sensation in its own expression, but endeavor to make us understand his ailments, because of the mouths of his friends and attendants, they are usually altered and erroneously stated. So the wife's statements here are very important, although his situation. Of course, sulfur comes in forefront with burning and psoriasis and swelling in the legs. We're looking at the atrophy of macular degeneration, which essentially is being in the repertory known as atrophy and inflammation of choroid. We're looking at profuse perspiration, and just about every remedy coming in through into mind. Prostate revitalization come forward with iodatum, which seems to be very relevant, medorinum and conium and Barretta carbonica. We redid the revitalization, including diabetes, hypertension, including previously, I had the number 4 importance on all prostate and desire for wine and cheese and cookies. And this is repertorization without any inclination or underlining of symptoms in this case. Phosphorus, heme, not mere sulfur, not stomacha, lycopodium, etc. So my prescription here was sulfur 6C in water potency 1 time per day, and conium maculatum 30C water potency 2 times per day. 3-week follow-up. He said he was not as angry. His wife said so. Skin is better. He drinks less, actually haven't had a glass of wine in 2 weeks, and feels less hurt about first marriage. There was no changes. Prescription follow-up 3 weeks later. Decided not to go for radiation. He decided to research instead of blindly listen to anyone. He decided to research what radiation can do to him, and decided not to go through and just stay strictly with homeopathy. He said, I am not afraid. I had a good life and I don't want to suffer humiliation. He's not waking up as often at night, and also didn't have any experience of incontinence in the last month. His skin is itchy again. I increased the dose of sulfur to 12C. I stayed with conium at 30C with no changes. 6-week follow-up later, he wasn't waking up at night at all. He was stopped drinking, so he was no longer drinking alcohol. He stopped eating sugar. And on his birthday, he had only a tiny little sliver of cake. He's generally good. He doesn't argue with his wife anymore, etc. We are expecting next follow-up in about 3 weeks, and let's see what happens. The correct remedy is always a remedy indicated in this case. So The principles of the remedies for prostate cancers are Sabal cerulata, Saxagria, Tuya, Conium, and Lycopodium. So Saxagria is a remedy indicated in a man that feels burning pain with urinary passage following an urine retention. Is troublesome, more likely to respond to Staphysagria, often sentimental and romantic. Tuya is when the prostate is enlarged and the person has frequent urge to urinate. We're looking into Lycopodium. Remedy may be helpful in urine slow to emerge. Prostate is enlarged and impotence may be also an issue. We're looking in pulsatilla, where prostate problems with discomfort after urination and pain that extend to pelvis and into the bladder, worse when man is laying on his back. So laying on his back aggravates. Causticum is urine loss when the person coughs and sneezes. So again, incontinence. Sebal cerulata, very frequent urge to urinate at night with difficulty passing urine and feeling a coldness in a sexual organs. We're looking at chemophilia ubellata, and this remedy is often helpful when the prostate is enlarged with urine retention and frequent urging. Clematis remedy often indicate with swelling of the prostate that seems to have a narrowed or tightened urinary passage, and that remedy is often indicate post-Western medical treatments. We're looking at medorinum, which is considered in prostate cancer when heaviness of the prostate occurs with painful and enlarged painful urination, and geranium maculatum, hamamelis, crotalis, hardes, and are remedies that should be considered in hematuria and a prostate cancer. So quick summary, I know we're running out of time, 2 minutes. We need to promote a healthy lifestyle and educate our patient about first symptomology of prostate cancer or any kind of prostate challenges that a patient may experience. Of course, avoid sweets and sugar, cut down on salt. In the first case of asymptomatic enlarged prostate, one of the massive factors were age and genetics, as well as obesity. We're looking at prostate gland is important to men's reproductive system. Clearly, prostate conditions can benefit from homeopathic treatment either on its own or integrated with medical protocols. Fortunately, prostate cancers tend to progress slowly enough that can be treated successfully in most cases. At the end of this presentation, I would want to say thank you very much to my amazing staff at my clinic, Rose, especially Anna, Juliet, Patrick, Alison, and Naomi and Patrick. I think Patrick got twice thank you. Without those people, my ability to work and practice and really concentrate and focus on homeopathy would be not possible. Thank you very much, everyone. If there are any questions, I will be here.
Thank you. Thank you so much, Hannah. This is a wonderful presentation where you explain all things about the prostate and the first, and like the anatomy, the physiology, and the pathology, and all in the sequence, and the proper treatment. And this is a wonderful presentation for a disease condition. So thank you so much. We request all of you to join DHMA and Homeopathy World Community. And here, Hannah, is this is for you from Delhi Homeopathic Medical Association and Homeopathic World Community. There is a certificate from all of us. This is for you, and we will also email to you this certificate. So wonderful presentation. Thank you, Hannah. Now we have our second speaker, Dr. Hira Agarwal. Dr. Hira H Agarwal is an ex-board member of Homeopathic World Community, and he's a member of DHMA, Delhi Homeopathic Medical Association. He's an international speaker. He's a direct student of Professor George Witholker, sir. He is a visiting faculty of the Henneman College of Homeopathy in England. He is a secretary of WFAM since 2002. He is a regional representative for India West for World Health Awareness Organization since 2016. He is recipient of Rotary Foundation Scholarship, under which he was the youngest GSC team member and visited England in 1988. He also has teaching experience in Mater Medica, first working as professor and later head of department at GNR Homeopathic Medical College, Solapur. He has many publications in national and international journals. So welcome, Dr. Hira Agarwal, sir. We have many things about Dr. Hira Agarwal, but Dr. Hira Agarwal is really a gem of homeopathy. I also learning many things from Dr. Hira Agarwal, sir. So Dr. Hira, please unmute yourself and start your presentation.
Hello, I hope I'm audible.
Yes, sir.
Good evening, one and all. Namaste to everybody, a common namaste to all over the globe, rather than saying good morning or good evening. It's a very good presentation by Hannah before me. The way she has narrated the whole situation with the references of the organon.
Dr. Hira, sir, is there any, your presentation is there because you are
Yes.
not getting the screen. Yeah.
Are you getting it?
Not on the, okay, we got on your screen.
Share screen. Bolo. Is it?
It will be better if you share the screen. Yes, please.
It's here now?
Yes.
So, going ahead, I am happy to have this evening today in association with Delhi Homeopathic Medical Association and Homeopathic World Community. I am thankful to both their organizers for giving me this platform to share my little bit of experience and expertise. So, we will go to the topic of hepatocellular carcinoma. So it is basically the primary malignancy of the liver. It occurs predominantly in patients with some underlying chronic liver disease or cirrhosis. The chronic underlying disease mostly are hepatitis B or hepatitis C. The incidence has been increasing trend all over the globe. It has been increasing very drastically, but it is most in highest in Asia and Africa because of the high prevalence of hepatitis B and hepatitis C. The risk factors which are there in hepatocellular carcinoma are cirrhosis of the liver due to hepatitis B and C infection, and alcohol is one of the major cause of cirrhosis of liver. We see a lot all over the globe where alcohol consumption, the frequency and the quantity of alcohol consumption has been drastically changed. Even youngsters today are going for these alcoholic situations. We are seeing a lot of schools that have come up where young children need to be admitted to detoxify alcoholism. So this has been a strong menace or a strong factor which we have to all take care of. It has been very easy, not only alcohol but the drug addicts also. So addiction for alcohol has been a very common problem which we have to be very much vigilant about. Now, hepatitis B can lead to the development of hepatic cellular carcinoma in the absence of cirrhosis also because of the integration of the viral genome into the host DNA. Co-infection with HBV, means hepatitis B and C, further increases the risk. Many patients are co-infected with both viruses, but it's very difficult to see both viruses, B and C, in the same person. As in homeopathy, we discussed that if strong infection is there, the weaker affection is not seen. So hardly I have ever seen, or it's very difficult to see both co-infections. Risk factors that are seen in hepatocellular carcinoma are non-alcoholic fatty liver disease and non-alcoholic steatohepatitis. Morbid obesity and metabolic syndromes are type 2 diabetes, dyslipidemia. Rare associations are like alpha toxins, thyroid, etc., and so on. What is the pathophysiology that we see is one is the viral hepatitis B, C, which gives chronic liver disease, which gives cirrhosis and directly hepatocellular carcinoma. In non-cirrhotic, there is one pathway which is the non-cirrhotic pathway, in which there is a regenerative stimuli, environmental co-carcinogens. Environmental situation is very important, the way the environment is, alpha toxins, hormones, genetic situation, all this is a non-cirrhotic pathway towards hepatocellular carcinoma. So we have two pathways. One is because of the cirrhosis and second is without cirrhosis. So what are the available treatment options? This is also important, as Hannah has given a very exhaustive narrative. He has narrated the available options for prostatic cancers. We will show in short, because that also, when we are treating homeopathically any case of any cancer, we should also know the available treatment in the other patches, at least some bits of it, not in thorough detail. So available treatment here are liver transplantation, which remains the best option for patients with underlying CLD or HCC within Milan or USCF criteria. So we have to know what is Milan criteria. If they are sitting in that fitting in that Milan criteria or UCSF criteria, then liver transplantation seems to be the best option. Then liver resection, partial liver resection, part of it is resected or removed. Then radiofrequency ablation, RFA, and then transarterial chemoembolization. The arteries are being embolized and the blood way is stopped so that the further growth of the tumor is stopped. And this is seen in multinodular tumors mostly. Then there is transarterial radioembolization, where the portal vein is thrombosed. Then you have the stereotactic body radiotherapy, where the portal vein again is thrombosed, but in a different way. And there is systemic therapy, where they give various systemic medications like sonography and others. Now, what are the important investigations? As an treating physicians, we should also know how it is diagnosed, or what are the things which will give us an understanding that the patient is suffering from HCC. So USG will show in a liver SOL, where background liver disease like cirrhosis or hepatitis B or C is seen. But here the portal vein patency is seen. Patency of the portal vein is very important. Findings on USC should be confirmed with CCT or MRI abdomen. Once you get something on the USG, it should be further confirmed. And once that is confirmed, then you have to go for alpha protein levels. In alpha protein levels, in many of the HCC, alpha protein levels in 75% cases, it is elevated. And elevation of greater than 400 nanogram per ml predicts for HCC with specificity greater than 95%. So alpha fetoprotein is one of the major hallmarker which shows that, yes, this person is suffering from hepatocellular carcinoma. Now, if you see cross-sectional image on CECT, HCC generally appears as a focal nodule, a small focal nodule with early enhancement of the arterial phase with rapid washout of contrast in the portal venous phase of a triphasic scan. So if you see the portal vein, there is a total washout of it. On an MRI, the HCC generally demonstrate a high signal intensity on T2 imaging. If you do a biopsy, in which cases biopsy is done, whether biopsy is needed, when we get all those things, many a time biopsy is not needed. But biopsy is needed in cases where there is low alpha protein, alpha fetoprotein, and in patients whom non-surgical resection is planned. In patients with elevated alpha fetoprotein and consistent imaging characteristics, patient can be treated presumptively for HCC without a biopsy. So here, no biopsy is needed in such type of cases. Now, lab studies, this is one of the best way to estimate or analyze assess the status of liver function. So liver function becomes a major issue where you have to assess whether the person is status quo, getting better or getting worse. Now, in child pug score, what are the various things that the liver function are tested are there are variables and there are the scores. This is a very simple understanding where for clinical work, this can be used, and this has been accepted all over the world as the child pug score as the best thing. So first is encephalopathy. If the person has come to you and he is in a good state of mind where encephalopathy is absent, so you get 1 point there, 2 points is given to mild to moderate, which says hepatic encephalopathy. Then they go into hepatic coma. So when there is a person going into a comatose stage, he is given as 3 points. Whether there is an ascites, these are all clinical conditions. So this is very easy to assess a hepatocellular carcinoma. So second is ascites. If ascites is absent, the person gets 1 point. If it is score is 2 when it is slight to moderate, and if it is really tense, then it goes to 3 points. This also can be seen by the circumference of the abdomen, and also you see that the umbilicus is totally tensed. You hardly can even touch the abdomen. That tensile strength you can see of the abdomen. Now bilirubin. Bilirubin, when it is less than 2, now you come to the liver function really from the blood point of view. Bilirubin less than 2 is 1 point, between 2 to 3 is 2 points, and more than 3 is 3 points. Albumin more than 3.5 is 1 point, between 2.8 to 3.5 is 2, and less than 2.8 is 3 points. So patient getting 3 points all over is definitely in a very bad phase, and patient with 2 and 1 are definitely good. Prothrombin time is again 1, that has to be assessed. Less than 4 is in 0.1, less than between 4 to 6 is second grade, and more than 6 is third grade. So if you can keep this chart also for a hepatocellular carcinoma which is coming to us, this is very minimal and very easy to assess. So this can be a very good assessment chart for us. Then in the lab studies, what you see in CBC, a platelet count below 1 crore is highly suggestive of significant portal hypertension. So portal hypertension is again very important to assess whether the person is going to a more difficult situation. Then you have to do a etiological workup where you can see the hepatitis B or hepatitis C viral load and their genotypes of what is happening with hepatitis B and C. Viral load we have to check out, and here again in hepatitis B as well as C, homeopathy works very beautifully, though they are not going towards hepatocellular carcinoma, but B and C both respond well where their viral load goes down. Now, if you see histological findings, tumors range from well differentiated to anaplastic. The fibrolaminar subtype is associated with a better prognosis. So possibly because it's not associated with cirrhosis and it's more likely to be resectable. Various immunohistochemical markers are available like AFB, RNase 1, and hepatocyte paraffin antigen 1, HepPR1, and glycine 3. So these are various immunohistochemical markers which can be also done where patient can be, if either they can afford doing it, can be done very easily. Now, various classification and staging systems are useful for treatment. So these are two basic classifications all over the globe that are being used. One is the TNM classification for hepatocellular carcinoma, and the second is the Barcelona Clinic liver cancer staging system. This BLCL, the second one, is most used all over the globe, where it is very easy to assess and very easy classification system that is there. And what is that classification system you see? In the case of hepatocellular carcinoma, stage 2, stage 0, stage A and C, and stage D. So stage D is the terminal stage where you see that the child pug store that we said was A. In here, the child pug store is between A to B, and the child pug store is C. Child pug store is very easy to understand. And from that criteria, we can see that we can stage the patient very easily, whether it is stage 0, stage A to C, and stage D. Then what we see is the tumor size. In second stage is tumor size, single size less than 2. Single tumor size is less than 2 centimeter. In early stage is single but 3 nodules, and it is between or equal to 3 centimeters. The intermediate stage is multilodular. Advanced stage is where the portal vein is invaded. The portal vein gets blocked, and terminal stage, you can see everything is, the childbirth store itself says that the person has gone into stage D. Now here also again further, single nodule and multiple nodules. Single nodule or multiple nodules, they are less than 3 or equal to 3 centimeters. Portal pressure you have to check out, where it is increased or normal. If it is increased, it goes to second stage, but if it is normal, they can go for resection. But these are the cases of stage 2, stage 0, A and C. We can really work with all the stages. This is the better part of homeopathy. What is the magic of homeopathy here? You can see is for them who to resect, which cases are to be resected. For them, this stage is good. But for us to understand which stage they are and whether we can reverse them from A and C to stage 0, or we can maintain them to at stage A or C, is very important. Even in hepatic encephalopathy, we have seen some cases which are reported. I have not treated, but reported cases also show that homeopathy works in all the stages of hepatocellular carcinoma. For that reason, state, any state of any case of any disease can be treated with homeopathy. Homeopathy cannot deny at any stage that we cannot treat you. So what is the prevention in this? How we can prevent this is family screening for hepatitis B and hepatitis C infections. How can we monitor these cases? Long-term monitoring, follow-up every 3 months for first 2 years of treatment, then for every 6 months up to 5 years, and annually thereafter. And what is the things that we should do is USG, liver function test, and alpha-fetoprotein. These are the 3 things. If you are managing them for the long-term monitoring, this is enough rather than doing any other invasive or CETs or MRI of abdomen. Now, prognosis of HCC, overall prognosis for survival is poor with a 5-year relative survival rate in about 18.4% cases. Length of survival depends largely on the extent of cirrhosis of liver. Cirrhotic patients have shorter survival times and more limited therapeutic options. Now, in general, if you see cirrhosis for any type of maybe alcoholic liver cirrhosis, maybe infective liver cirrhosis, homeopathy works well. Even in simple viral hepatitis also, homeopathy has a very good role. Allopathy in general, for any type of liver infection or any type of liver function also, dysfunction of liver, homeopathy has very, very good remedies. Any remedy you can pick up and you can read, it has a very good system or action on the liver. So portal vein occlusion, which occurs commonly associated with an even shorter survival. So this portal vein, we should have an understanding of all these things. The portal vein pressure, the portal vein occlusion, because they say that homeopaths don't take into understanding or into consideration all these things. So these are the things we should also consider. And when we put ourselves in this format, then we are more clearer in our understanding and putting this into the whole system. Now, we start with the role of homeopathy. For 3,000 years and more, the disease cancer has been known to the medical profession. Cancer is known also the emperor or king of all diseases, because in last 3,000 years and more, our humanity has been knocking at the door of medical profession for finding and cure. Yet there is no answer for cure. There is palliation definitely, but there is no cure. This was given in the Fortune of March 1937. Cancer, when a localized disease, needs to be locally removed by surgery or use radiation to burn them out, or chemotherapy. But due to their side effects, treatment becomes more painful and unbearable, lowering the quality of life. This is very important because at one end, you do chemotherapy or surgery or radiotherapy, and what patients have felt and what we have seen, their quality of life has gone. They become a vegetable. They cannot eat. They are just living. But are they really living? Because they cannot eat any food. If you have a cancer esophagus and after radiation, the whole esophagus has been structured. So they can't eat food. They have to put a pipe in the abdomen, and then from there they have to give the food. So all this quality of life is deteriorated. Cancer of the tongue, they cut the half of the tongue, they can't even talk, they can't even speak, nothing can be, they cannot even hurt. They become so irritable that nobody can understand them. So the quality of life in general becomes very bad. Definitely in some cases, the quality of life is good and they can tolerate the chemotherapy, radiotherapy, or surgery also well. But most of the cases, the quality of life deteriorates very badly. The role and efficacy of homeopathic medicines for the treatment of cancers is still largely unknown. We should really accept this, and unproven. So far, a lot of research is going on all over the globe for its efficacy. So this is a major situation we all homeopaths should do. Though it is unproven, we should go for proven things. We have to prove that homeopathy works in cancer. Not only the quality of life, but it really works very beautifully. And that is why research on various models have to be done. It is integrated today along with the conventional treatment as an adjuvant therapy. It is not the first line of treatment. It is just added. It's an add-on to whatever the conventional medicine is, conventional treatment is going on. And what we have seen is it increases the body's ability to fight cancer. It improves their physical and emotional well-being and elevates their pain resulting from the disease or conventional treatment and improves the quality of life. That is true. Definitely true. Increases the body's ability to fight cancer means the moment they are labeled as cancer, the person becomes so much of panicky. It's like a death sentence to them. Cancer means I will definitely die. So the moment they break down emotionally and morally, unless and until they become strong morally and emotionally, they cannot fight the disease itself. So here, homeopathy has a big role, big role. No medicine on earth can build a person's emotional and mental situation. For simple example, a mother's child is dead. The mother is unable to accept that fact and she becomes very much dull, depressed, unable to talk. You have seen Ignatia and Attermoor working. That shock, that grief, that fear. Even now in this, during this fear of COVID, in the COVID part, people were, the moment they were getting COVID positive, they were feeling as if they will die tomorrow. Many people were getting admitted in the hospital just because of the fear. People have died more of fear rather than the disease that we have seen in COVID. And why arsenic came into picture more strongly? Because of that fear, that insecurity. And that is why arsenic helped in many cases. So this, you have to prove. How can you prove this part of homeopathy in research is a very good part where we have to do a research. How emotional factor changes once a person is labeled as cancer, the way he's broken down. Many people come, we have not told the patient that he's suffering from cancer, but you don't tell him also. So the patient is unaware that he's having cancer. The moment they know that they have cancer, they are totally dead at the same time. They are that frightful. But this is the major part where homeopathy has a role, but this needs research. And this is something where positive results will come up, but how to evaluate that emotional cater and how we should show that change in the emotional cater is something to be done a research. Improve their physical and emotional well-being. This is definitely everybody knows. Now, classically, homeopathy in the treatment of cancer, what has been seen? A European survey says there was an European survey where prospective one-year observational study of cohort of 259 patients under homeopathic treatment with a matched cohort of 380 patients undergoing conventional treatment was done. And it compared the quality of life, fatigue, anxiety, and depression. And this is the citation for which, if you can go there and see, and definitely there was a change in the quality of life, fatigue, anxiety, and depression. But we need that qualitative is seen, quantitatively. How can we quantify that through research is something we should think about. In the homeopathic group, significant improvement in the quality of life after 3 months, and improvement further continued for 12 months. Fatigue and anxiety, depression improved a lot. While in the conventional group, what happened? No significant improvement in the quality of life, fatigue and anxiety, depression. did not improve in the convention. This is also seen. This we see daily after chemotherapy, their blood sugar, their CBC drops, their hemoglobin drops. In general, they become very much difficult. After chemotherapy, radiotherapy also, there is a lot of burning sensation. The heat becomes so much that they get heat flushes from the body. The heat is intolerant for them. So this radiotherapy has a very big side effect rather than effects. So what is the global perspective now? Comprehensive worldwide survey concludes that CAM means alternative medical therapy. Complementary alternative medicine is used all over the globe commonly. In Europe, an average of 30.59% were using for some form of complementary alternative medicine therapy. In Belgium, homeopathy is most commonly preferred therapy among the CAM. In France, 34% of patients were using CAM, and homeopathy was the most frequent choice. Amongst the complementary therapy, homeopathy again becomes a more better choice. So these are something, they are good milestones that homeopaths have to work and they can go further. In UK, homeopathy is one of the 8 most popular CAM therapies used by cancer patients. So this is known, but we need more perfect conclusions, derivations, and research. Now, what is the Indian perspective for cancer? In India, Khudabakhsh laboratory reported significant anti-tumor effect of chelidonium and lycopodium. Another study in India reported retardation in liver tumor growth in mice and also reduced the incidence of chemically induced sarcomas. So this is a known. If you can see on this citation, if you can go to this, you can have all the details about Khudabakhsh laboratory that has been done. Mr. Khudabakhsh is one of the good researchers, but he is a very good pioneer of homeopathy and has done a lot of research work for homeopathy in general. Though he is a scientist of a different origin, but he has a very good affinity, love for homeopathy, and has done a lot of work with homeopathy research. Then collaboration studies done by Dr. Prasanta and Pradeep Banerjee with the American researchers at the University of Texas, MD Anderson Cancer Center. Now these two, son and father, Prasanta and Pradeep Banerjee, unfortunately, both have passed one after another last year. It was a big shock for the homeopathic community and fraternity, where they have done a lot of work in cancer specifically, and they had brought out a book which is well known all over the globe as Banerjee Protocols. So they had brought out a book as Banerjee Protocols, and today also everybody uses it with very good efficacy. And I was fortunate to call their whole team to my place, Solapur, in 2014, where we had a big cancer camp, and we had treated about 350 different types of cancer cases. And after which the flow of cancer patients started in my clinic. So I cannot forget these two, son and father, who had done a great mammoth work with cancers. In this study, they have reported that homeopathic medicines stimulate induction of survival signaling pathways in normal lymphocytes and induction of death signaling pathways in brain cancer cells, especially with Ruta they have done. So all these things they have given in their book, and it's really very seal. And what we can see, this cancer cell death was initiated by tolerem erosion and complete through mitotic catastrophe events. So these are the ways we have to put some research, and this is the way we have to bring out our research in this type of situation. Now, this is my clinic data of 2019 to 2020. The way I had patients, I have not taken 2014, those 350 cases that we had seen through the cancer camp. Now, CA larynx, buccal mucosa, CA breast, all types of cancers we had seen. In that, I had seen about CA liver, 3 cases, out of which 1 case I will be presenting here because she lived for about 6 years of time from what we started in 2015 with her. So these are the cases I had. Now, this is the case that I want to narrate you. She was a 35-year-old lady with no comorbidities. Her ECOG score was 1. She was diagnosed with HCC, presented with right upper quadrant pain, loss of appetite and general weakness, no history of jaundice or GI bleed. So what does it show is that history of jaundice means the portal vein blockage, GI bleed means portal hypertension. All these things show that you have no portal hypertension, no occlusion of the portal vein. Now, this is the hepatic tumor you can see in the CT scans that were done. This was in 2015 when she did that and came to Solapur. This is the portal vein that you can see non-occluded. Here you can see this non-occlusion. And there was also an extrahepatic disease from where the MRI was showing, the scans were showing it. Now, course of treatment, it's a 6 years treatment. So we had created a chart like Hannah had created, but it was becoming too exhaustive. So we concise that and we have put that in a short one slide itself. So various parameters we have taken on the first, then 2015, 16, 17, 18, 19. So till 2021, till today, we have taken their symptoms. Like she started with pain, weakness, and pain in the left upper abdomen. And child status, the child pug score, as we said, was in which we saw all those 5 parameters, encephalopathy, albumin, and all these things. So child pug score was throughout A. So it was in the first parameter itself. Alpha fetoprotein was done on the first time. When she came, it was 5.4. And now we did not do in between. It is 5.6. Size has been increasing. The tumor size has been increasing. In 2015, it was 13 into 8. Then it came to 15 into 13. So you can see that in 1 year time, what is important for me was in 1 year time, hardly it was a 2 centimeter change. In a 1 year, it was not that fast moving. Then in the further time, you see it is 16 by 15. It was in first year, it was 2 centimeter. In the second year, it is 1 centimeter. Then in the third year, again, it's 17 centimeters. So it's only 1 centimeter. In 2019, it is status quo, 17 into 1. And with 2020, we did not do the report. And 21, you can see the progression as 18 into 17. So hardly in a year, what was important for me is 1 centimeter of increase in the tumor size, which was very important, which was showing that the medicine was helping her to, cancer cannot stop. Though we operate it, they go into metastasis. So it cannot stop. But what we have seen that we have hampered the medicines, our homeopathic medicines hampered the fast growth of the tumor. And you can see hardly, initially it was 2 centimeter, but further it was 1 centimeter each year. So it was quite a good change for me. And portal vein was patent throughout this situation. Till today, the portal vein is patent. Now, the Barcelona liver the staging system, we see that it was in the C group because it was having an extrahepatic disease and it continued throughout. But other things were okay. But the C extrahepatic growth, what she had also in the sonography, she had an cystic ovary, but that went away. But that's extrahepatic disease was still there. Treatment basically that we gave her was chelidonium and lycopodium. Chelidonium was given in a mother tincture format, and lycopodium we started with 6C, as Hannah said, because with this type of pathology, it's better we go from low to high. From 6C we started initially, then we went to 30, and finally it was maximum 200 that we have given till today. So 6, 3 times a day with chelidonium mother tincture, 10 drops 3 times a day. So this was the way we had given her. In between, because this was the case where when she was diagnosed, she was said that you will hardly have 6 months or 1 year to stay. If you do a surgery, you will hardly live for 3 months. But here you have seen that she is living for 6 years. And unfortunately, in 2019, her husband passed away, and in 2020, his father passed away. So those 2 shocks also created a big ripple in her. But finally, acid phos was the remedy when we are given for the grief. And when he had a bad bleeding per vagina, where her menses was very bad, and in 2019 and 2020, she needed to be given packed cell volumes or blood, because her blood hemoglobin dropped to 5.4 in these 2 years. And because that was dropped because she had a very bad shock, the husband passing away, giving rise to a lot of metrorrhagia, and the hemoglobin dropped. Otherwise, throughout, we did not give her any blood or any IVs. Her albumin was maintained, and this was something, a great thing that we had seen. Though she was coming from Pune, and she is still coming. You can see the testimonial that she gave us. You can hear it. The voice is coming. Can you hear the voice, the lady's voice?
Yes, yes, sir.
उम्र 40 किधर रहते आप? पूना में। पूना में। क्या तकलीफ थी आपको? आप कभी आए हमारे पास? 6 साल आगे पेट में दुखता था, हाथ पैर गलाते जाते थे, खाना नहीं खाया जाता था। फिर मैं यहाँ आई, जब से मेरे सब नॉर्मल हुआ। 6 साल में। 6 साल में।
So this is a short testimonial that we have taken of her. She has given a big testimonial, the way she came, what the doctor said and all. So because of the time constraint, we have shown you that the patient is still living. That is something very good for their whole family, for her, that she is doing her normal duty. She is not bedridden. She is doing her normal duties for the children, for everybody. And she is moving around from Pune to Sholapur. She is settling down. She is coming. So the quality of life means, this is the quality of life, that they can do their work. They are able to move around. She is eating, she is moving around. So that what else we can do? So this is something, great benefit of all the 3 patients that have gone in. And that is why I feel that we need some more things to be done. And really, we have very good remedies for liver as such. You have many remedies: phosphorus, lycopodium, hydrastis, chelidonium, Cardus marianus. But we need to learn our materia medica very well. Even in prostatic cancer, we have Sabal cerulata. So mother tinctures also has to be thought of in these terminal cases, or cases where the pathology has been very much bad. And so you have to read our materia medica. We have to be very specific at some times. And very much, there are various things like what should be the way we should treat cancer patients. Specifically, we'll come to cancer patients. So some cancers, when they come in an initial phase, we can give our constitutional therapy that we talk about. We can use that. Different ways. I'm just trying to give you what I have understood as. One is the constitutional, where we take the totality of the symptoms. We take the causative factor if there is anything, and based on the totality, we give the remedy. This can be used. The second is the causative factor, if there is any causative factor. Third is any peculiar symptom. You have very peculiar, queer, rare symptom in that particular case, we can really base on that. Fourth is when the pathology is very much strongly high, prevalent, and or post chemotherapy, radiotherapy. What happens with homeopathy is, when they come with post chemo, post radio, or post surgery, their totality symptoms have gone. They don't have any aversions, they don't have any desires, they're mentally totally, because they don't have any taste. They say that my taste is lost, I cannot understand anything. Mentally, they are just lying like a log. So it's very difficult to get their generalities, their mentalities, or their local aversion desires also. They are just eating food or drinking food like a vegetable. You have to just feed them and leave them. So at that juncture, when you don't have such type of any much mental symptoms or physical symptoms or general symptoms, it is at that time where you have to take the essentials of the prevailing pathology. What is the prevailing pathology and what is essential in that prevailing pathology? And we have to base our prescription based on that prevailing pathology. And here we have various mother tinctures or remedies of that particular organ remedies that we talk about, and that helps very beautifully in such terminal cases. So this is my experience of treating many cases where we have given totality where phos have worked. Phosphorus also is a very good remedy for all types of liver cases. Lycopodium definitely has a very good role. So when the constitution, it's again, I'll tell you, if you get a constitutional remedy, if you get a remedy from the totality, it's nothing best than that. You can see that the patient will move so fast ahead that you don't have to look back again. But this is more of a supportive. When we give for the terminal cases, this is more of a supportive, and we can take them quite toward end phase that I have seen in this case. But if you get a totality remedy, a very clear remedy from the totality, that is the best part, and it really gives very good result, where you have to just keep a watch on the patient and things move very beautifully. So this was my small presentation. I am really very much thankful to both the Delhi Homeopathic Association and world community for giving me this opportunity to have a discussion with you. I am not a teacher. I am a small student. I am learning still. I have many of the students who teach me. My patients are my best teachers. I learn a lot from my patients, and I'm really very thankful that the patients have given me that faith. They come to me with faith that you will do something for me, and the way they come gives me a higher responsibility that I should really do my best and give them the best, and that keeps me going. My staff, my family definitely helps me to bring out all those things where only I am dealing with the patient, but they do the other things. I am then finally thankful to all the colleagues all over that somewhere I learned something definitely from each and everybody. So thank you once again, one and all. And now, if you have any questions, I will be happy. Whatever best I can do, I will give you.
Sure. Thank you so much, sir. Thank you so much. And this is a webinar for the education purpose only. And here we are not prescribing any medicines. If you have any doubt, you can just follow your homeopath nearby you, or you can consult your homeopath. Yes. So there is no prescription here. So Dr. Shweta Singh, is there any question for any of the speaker?
Yes, sir. We have one question from Dr. Munish for Dr. For Dr. Hana. Does biopsy in prostate not lead to spreading CA?
I'm sorry, I apologize. Can you please repeat the question?
Yes, sure. Does biopsy in prostate not lead to spreading CA?
Well, that is a very good question. Thank you for asking. Yes and no. I mean, obviously, we know that if biopsy is done on point, there is very little low ability to spread. If the biopsy is being not careful, and we know that especially in the prostate cancer, it's being taken from 12 different spots, a patient is by definition at increased risk of spreading spreads of the prostate cancer. Absolutely. Unfortunately, this is one of the very common ways in Western medicine to diagnose and check all the abnormal cells or abnormal behavior that is very often an asymptomatic. Again, we can prepare patients homeopathically for the biopsy, pre and post. We can give them definitely an arnica and ledum and all the remedies that goes in with the first aid of puncturation, puncture wounds, or any kind of trauma.
Thank you, Anna. One question is for Dr. Hira from Dr. Monica Chabra. Sir, the case you presented, why didn't the tumor show any reduction in its size after homeopathic well-selected remedies?
Yes. As everybody knows, cancer is a disease itself which is growing day by day. It is not a self-limiting disease. It is a selfless disease, just running like a mad elephant. This is what I told you, that we were able to restrict the growth of these cancer cells in a year initially by 2 centimeters and post 1 year after 1 centimeter in a year. So if you can stop the growth, it means that is the best part of the story. This is where nobody has reached even. Nobody can stop the growth. Cancer itself is such a bad disease that it should multiply day by day and night. It's multiplying day and night. You cannot stop that. The day you will stop, you will win the medal of the world. That is where the whole research of the world is going today. Can we stop cancer? Nobody can stop cancer yet. So we have to analyze. That is why we should know the disease. What is the type of disease? What is the way of the disease progression? If you don't understand that, you have to understand that this is a very mad disease which is progressing day and night, which is multiplying day and night. And if in a year it is just increasing by 1 centimeter, it means you have restricted the growth of the cancer. The restriction itself shows that the homeopathic medicine is working. You cannot stop that. The day you stop, you will get the world prize for it. That is difficult. So initially you should understand that cancer cannot be stopped. The day you can stop cancer is something which everybody, the whole world is looking for. That is where the whole world is doing a lot of research. So sorry, I forgot to give my special thanks to my friend, Dr. Amol Kanetkar, who is a gastro surgeon. He helped me in understanding and making this more better. And the second special thanks is for the Nargis Dutt Cancer Hospital, which is in Barshi, away 60 kilometers from my place, from where I am getting a lot of cancer patients referred. The various ways I'm getting different cancer cases. So in 2014, as I said, we had a collaboration with this cancer center, and wherever they feel that the patient is unable to manage further medications, or they are poor economically, or they cannot tolerate, or they are in the, so they refer to homeopathy. So this is how I'm getting some more cancers. We are trying to collaborate more with them when they do a lot of work with the finding of screening patients. During screening, they get a lot of people, and we are trying to help them out in screening and trying to get our cases from them. So a special thanks to them for helping out. So I hope the question of the lady is clear. Any other questions?
Next question is for Dr. Hannah. Does the constitutional approach of homeopathy helps in cancer patients?
So there are a couple things I'd like to address. 80% of my practice are cancers. It's not just prostate cancer, but all of them. And the hardest to treat is glioblastoma. I have 5 of those cases. As Dr. here has mentioned, if anyone ever comes up with an ability to stop progression and division of the cells in cancer, will definitely win, rightfully so, the World Global Peace World Award and any other medical awards existing on the planet. It's an aggressive disease that multiplies faster than pregnancy. Essentially, it's being stimulated depending on the aggression of the cancer. It multiplies 5 to 50 times on the speed of a light. And so it's really, the division of cells comes real quick. And congratulations to Dr. Hira for being able to put in that tumor and stop the growth as progressively fast as possible. Remember, cancer cells, as it was shown in my presentation, tends to overlook immune system and grow on all the nutrients and vitamins and foods that you're taking to grow and multiply. There is a definitely situation when the brain gets confused. Now, I don't think there is such a thing, into your questions, I don't think there's such a response as constitutional remedy in cancer cases. I think the remedy is the right and the correct remedy in the case. And this is where it's important to take the whole history, all the symptomology, and as it shows in Onorganon, collect the data and information from loved ones, from wife, husband, children, friends and family, if it's possible, especially in the cancer cases. Why? In a case number 2 with a very aggressive cancer, the wife's statement was his behavior has changed and he became cranky and aggressive. He's never well since, really. I think a loss of his ability to function as a man. And going in deeper into the remedy, of course, we can understand why conium maculatum was the right choice in this case. Again, there are some remedies that have a better success rates in maintaining cancer, because remember, the word curation or curative shouldn't be really used in any form of modality, medical modalities. I use Materia Medica Viva and a desktop and a Bonninghausen repertory and my Holy Bible of Manfred Miller, homeopathic cancer drugs. I had the privilege to study with amazing homeopaths specializing or practicing in the cases that are complicated with pathology. And I need to underline one major area: any remedy prescribed accordingly to the totality of the symptom, with looking for SRP, which is strange, rare, and peculiar, is the baseline to prescribe a remedy. And if that remedy is prescribed correctly, you will find the right response of the body into that remedy. Again, the oncology materia medica, Manfred Muller, pleasure to meet and work with him, pleasure to use his book every single day, has every remedy with every cancer related into particular organ. And so it's very important really to follow good repertorization. Don't imagine patient symptoms or assume what you think patient meant. If a patient haven't expressed it and you had an open-ended question asking and not get information, move on. Don't assume symptomology, because that will lead you to the wrong remedy. And in a cancer division spread so quickly, every second counts. How you take the case count, how much time you spend count. And so majority of my cancer cases, I will spend a lot more time. Being in Tanzania, in Africa, we didn't have a lot of time to collect data, having 50 patients line up. In my clinic, I have the time to give to patients to collect data, history, information, very detailed intake form that will give you a lot of clues right off the start without even patient realizing. And again, that will lead you to the correct remedy. You will see the improvements from one follow-up to another.
Thank you, Dr. Hannah. Next question is, can homeopathy help in patients where metastasis has occurred?
Again, cancer is a very progressive disease, and at some point, a different type of cancer can and very easily metastasize. Again, it's a maintenance of a disease. If we are able to stop progression, stop spreads, it is a success in a case. Prolonged patient's life, it is a success in a case. I had the cases of glioblastoma where patients were told they will face the end of their life in 3 months. We had 2.5 years of an amazing life quality when he died with dignity without drugs and chemotherapy. And so when the case is carried on properly, your patient has a great ability to extend their life cycle, life expectancy.
Next question is autoimmune hepatitis treatment in homeopathy only diagnosed by gastrologist, no biopsy done. If patient taken both allopathy and homeopathy medicine, can he develop artificial disease? What to do in such conditions?
For me, it is the question. Sorry, I did not get it.
Yes, sir. Autoimmune hepatitis treatment in homeopathy only diagnosed by gastrologist and no biopsy done. If the patient taken both allopathy and homeopathy medicine, can he develop artificial disease? What to do in such conditions?
Now, artificial disease can be, there can be no artificial disease as such, but when in any autoimmune disease, for that matter, it may be rheumatoid arthritis, it may be anything. In an autoimmune disease, basically, if the patient is coming at an initial phase without any much dependency on allopathic medicine, the case is much clearer. And if you are not using immunomodulators or they have not used immunomodulators, then it is easy for us to understand the case much more better. Regarding the first question also, I would say that we should not be carried away. We homeopaths in general should not be carried away by the diagnosis of the disease. First thing, keep in mind. Patient may come with cancer, patient may come with rheumatoid arthritis, patient may come with asthmas. That is one part of the story, a diagnosis from to understand what is the person suffering from. What is the need? Do we give remedies from diagnosis? No. This is the basic answer. We never give remedies on or medicines from diagnosis. What we give for the patient. So now a patient is coming to you, a person is coming to you with a specific disease symptomatology diagnosed as maybe diabetes, maybe cancer, maybe rheumatoid, maybe asthma, whatever it is, XYZ. Initially, when they come to us, we have to see the personality as such. Now, there are two things, whether they are coming directly to us, which much of without any drug dependence of alternative medicine, or they are coming with us with drug dependence. In such chronic diseases, any chronic disease, asthma, arthritis, cancers, if they are coming with drug disease dependency, we have to give thyroids, diabetes, hypertension. Now, they are all drug dependent medicine diseases. So now when they come to us, we still help them out. And what we do in these cases, that we add our medicines to them. And what we have to see after that, that their dependence on drugs should come down. Like, for example, a case of severe arthritis rheumatoid is coming to you. They need 3 to 4 painkillers per day along with an immunomodulator. They are taking some immunomodulators every week and they have come to you. Can you say no to them? No. You have to give your medicine and see that the immunomodulator should be first dropped out. Let the painkillers be there. Then you have to drop out from the painkillers, like 3 per day. Now you are taking 2 per day, now 1 per day, now sometimes. So this is how you will see that they have to have a slow changeover from the alternative or dependency of drugs to non-dependency of drugs. This is also seen in hypothyroid cases. They are taking 150 milligrams per day, then every Saturday, Sunday, 200 milligrams. And then they come to you and they say that, can you treat our hypothyroidism? Yes, we can treat their hypothyroidism. But when we start treating, you have to have a differentiation that after 3 months at least, we are dropping out or we are lessening their medications, whatever the medications they are dependent on, and they are not disturbed by it. A person who is dependent on medicine, any skin case, like they come with psoriasis, bad psoriasis or eczemas, they are applying medications or they are taking some immunomodulators. The moment they stop applying any medicines, the third day they are getting a flare-up. What will you do? So in all these cases where they come with a dependence on medications or conventional medicines, it is a very big challenge for us that first they have to stabilize them. How will you find their stability? that when they came to us, it's only one sign. They came to us because taking all those medicines that they were taking, still they had some symptoms. Still they had some symptoms. They are coming, like for example, I'll give you a concrete example. Like they came with cancer. They will either come as an alternative, they have to take something alternative, or after taking the medications also, they still have some symptoms which are not going with the medicines that they are taking. Now, once that symptomatology is going away, they are feeling better, their general condition is better, there is general improvement, then you see that, then you say that, yes, my medicine has started working. And then you start reducing the medicines. Even in psychiatric cases, they are coming to you. They are taking all schizophrenic, various medications, 4 or 5 medicines. They are not sleeping with that medicine also. Now, when we give the medicine, they are sleeping now. It means that our medicine has started working. Though they were taking 5 pills, they were not sleeping. It means that remedy was still not helping them out. Now they are giving a good tranquility. Now you start slowly, after once they stabilize, you start reducing their medicines. This is applicable for all type of cases, not only cancer. So first thing is, we should not be carried away by the disease diagnosis. The moment you are carried away, then you get an idea that I have to find a remedy from that particular system only. Cancer remedies only. Any remedy can work anywhere. First thing, any remedy. It can be aloes also, it can be ruta also. For cancer of bowels, ruta also works. But ruta, if you see, has the highest anxiety in the mind phase also. So you can get ruta from the mind rather than from the locals. The mind is now matching to the locals. So don't get carried away by the diagnosis. But why diagnosis is important is, as the question was asked before, we should know what is the disease phase, what is the pathophysiology, what can be the complications of the disease finally. We should not say we are giving homeopathy and you can take our homeopathy and everything is going well. You cannot say that. You should know what maximum complication the person, whether the person is going towards complication. We should have that understanding. And that is why diagnosis is important. The pathophysiology of the disease is important. We should know what is happening with the case. And that is why we should keep that in mind and give our medicines, maybe from the totality, the best, causative factor, PQRS, and finally the essentials of the prevailing pathology. This is the way I at least go in for, and we have a clarity why I gave a remedy. Why my remedy basis, what is my remedy basis? And then if they are coming out without any result, I try to analyze myself what was missing with me, whether it is some symptom that is missing there, whether that is something which is not there with me. It happens many a times that at the first consultation, the patient does not open. Once a good rapport is developed with the patient and the patient knows that this doctor is sitting for my benefit, then they say many of the things which they have ignored saying in the first consultation. So this is very important. You have to first develop a rapport with the patient. They should feel that this doctor is sitting for me. He wants, when you start asking their emotional part, nobody will give you their emotional part. You have to make them feel that, yes, he needs you for the understanding of you. And then you will see that things go in a better way than what we think before. So this is my way of understanding, and that helps. Any other questions?
Yes. Can homeopathic treatment be taken along with allopathic protocol?
Yes, yes, definitely. You see, there was one question also, why people come to homeopathy at the last end. Homeopathy, people in all diseases, not only cancer, even they come for the allergic rhinitis, they come at the end phase. They come with polyps, 3 times they operate the polyps and then they come to homeopathy. So homeopathy has been a second choice, and that is why a name has been given, alternative medicine. So if we as homeopaths, it is our duty to make that frame of alternative medicine to as first line of treatment. Homeopathy, the remedy for the 21st century. We should do that. It is our responsibility. I feel so. We have to bring to the masses, we have to go to the masses, and acutes are the most best. Acute diarrheas, acute dysenteries, acute fevers, acute asthmas. If you can treat that, then the mass can come to you. If the masses are turning to you, then you will be, or homeopathy will be the first line of treatment, not the second line of treatment. Even in cancer, the moment they say cancer, people are so much frightened that they want to go to a higher centers. Do you have a higher center? We have only our consulting rooms. The higher centers, the ambience, the machines, they are doing something. But what they're doing is in their favor or not in their favor, they don't know. But something is going on. That something is going on is an impression for them that something is going on. They die also, they say they have tried everything, but the patient died. They accept that. But if we try and they die finally, they don't accept it. What you did? You did only you have given globules. So you need hospitals where you can keep the patients. You should do something for them. You should do our imaging, what they do, but we should give our medicines. So we need to do a lot of things yet to do. And that is why sometimes I feel that this first only one incarnation is insufficient to work in homeopathy. We should need at least 2 or 3 incarnations more simultaneously so that we can really put something strong milestones for homeopathy.
So yes. We have a question from our YouTube channel. What about colostrum?
Colostrum also is a very good medicine. Whatever I have a little bit of knowledge of colostrum is, it helps to build up the immunity. That is the basic understanding for colostrum. So in general, if you also take colostrum daily, it helps to build your immunity. In cancers, you take multivitamins, you take that wheat grass, all those are immunomodulators of a natural origin. So colostrum is a natural origin immunomodulator or immunostrengthener, not modulator, immunostrengthener. It builds up your immunity. So in general, daily food also, if you take colostrum, it is called good. It has nothing specific as cancer.
One more question is there. What is prophylactic meals and precaution hepatic cancer?
Prophylaxis in hepatic cancer is when they do a screening of a particular area. You want to find out in that area what are the hepatic cancer. Now, because of this cancer being very prevalent and has been exhaustive, they have started screening more big areas, villages, like you have cervical cancers. Why cervical cancers or pap smears are being done with a lot of people? Because women don't come out with any problem. They just keep them with themselves, especially in India, what they have seen. They are very much afraid, also very much shy to speak about their licorel discharge or white discharge. So a lot of females are suffering from vaginal cancers or cervical cancers. So they do a mass screening. So in that mass screening, when you do, cirrhosis is very, very common. But in that cirrhosis, whether they are having a co-infection of hepatitis B or C, with all the vaccination that is going on today of hepatitis B and C, still people are having, it was initially only one hepatitis A. Now B, C, D is also coming up. So from where are they getting this? All these are questions. So screening is the only way we can find out whether there is an infection of hepatitis B, C. If they are infected, they are more prone for hepatocellular carcinoma. They should not go into cirrhosis or any, what medications they are taking, whether viral load is increasing. They should take diet very properly. They should not go for alcoholism. If they are having hepatitis B, C and they are taking alcohol, they are the most prone people for. So this is how screening will help you, or understanding of hepatocellular carcinoma will help you.
In the case you presented, sir, 6 years is a big extension, while it could have spread to other parts. What is the comparative data in allopathy?
I really don't know. That is why I was sitting with the other doctor, I told you. He was also amazed to see. That's why he sat with me last 2 days, 2 nights rather, not days also, because he was also busy the whole day. He was also surprised and impressed that homeopathy, yes, this is how we have to turn our conventional medical friends to us, and from that we will develop a rapport with those people. We are trying to do a research. Last month we had been to Pune. We had seen an institute, National Toxicological Institute, where they work on mice. They induce tumors, or they cut a mice, they create a lesion or they create a wound, and then they measure that wound. And if you give your remedy, calendula or staphylococcus or hypericum according to the wound, what happens in 3 days, what happens in 7 days, what happens in 10 days, they will measure that and give you back. So this is where this type of research has to be done. This type of work has to be done. So this is a question for me, because I hardly have any, I don't have many cases of hepatocellular carcinoma where I can compare with others. One case you cannot compare. One case, nobody will tell you that you have done a great job. But these are small tidbits we are gathering now. One case, nobody will say. If you give one case that I treated a nasal polyp, they will say that was getting better also. So in one case, it is very, but for us, that one case itself is enough of energy we should utilize for next cases. That understanding should be applied for next cases.
And what type of cancer was it?
It's a primary hepatocellular carcinoma. Primary hepatocellular carcinoma. There are two types. Now, one is direct, where you can see the carcinoma in the hepatic liver itself, or the second is where you have a metastasis in the primary is somewhere outside, the secondaries are in the liver. You have many other cancers where you have secondaries in the liver. So this is primary hepatocellular carcinoma.
We have one question from our executive member, Dr. Yatindra Bhatnagar. So very common question is, should we start treatment before biopsy or after biopsy? As very old saying, biopsy aggravate the cancer.
See, it's very difficult in today's time. The moment you see, there are a lot of things which play a role in it. A person, when he is diagnosed as cancer, depending on the age, depending what profile he has in the family. Suppose he is the whole family karta, means he is the whole responsible person of the family. You will see the whole family is bonded with him. Their relatives are bonded. Their friends are bonded. So the moment they are diagnosed, there are a lot of inputs from all over family, friends, relatives, that you should do this, you should do that, you should do this, you should do that. You should take to higher centers. You should do the biopsy. How can you say only from that it is there? So you have, from our point of view, when everything is quite okay, that is why even the conventional medicine today, rather than biopsy, they are thinking of anything that is non-invasive. That is why biomedical markers have come up. So they are also thinking that definitely it creates a ripple in that, and it creates an easiness to the cancer to shift more or progress more sharper. Cases have been there. But we cannot say, don't do it or don't do it. Who will take the responsibility? You cannot take the responsibility, don't do the biopsy and I will treat, or do the biopsy or I will treat. You cannot do that. So you have to have a frame of reference. You have to work in a frame of reference where you have to take not only the patient into confidentiality, but the whole family into confidentiality. The patient's relatives have to be confident that whatever I am doing in the interest of the patient. Whether biopsy will help or biopsy will not help, you have to tell them. In some cases, biopsy will help. In some cases, biopsy will not help. Now, this is how, now the question was good again, because everybody is serious that how this person has, or this patient of mine has survived for 6 years. Now they want to do a biopsy because this patient has not done the biopsy. Now, next time when she comes from Pune, we are doing a biopsy just to understand what is reality inside it. So next time we will do the biopsy. So in many cases, we have to be on guard. It's not only giving medicines, but we have to take the whole responsibility, not only of the patient, but the whole family also. What you are doing has to be justified. You cannot say, I will treat. Though in India, one thing is good as compared to the West. I have seen the West also. You cannot take the patient directly. You have to go through various channels, and something happens to the patient, you are under a very bad situation of money and rules and regulations. That part, the Indian government, being an official medical system, it's easy for homeopaths here in India to work very easily, fill all type of cases. It may be cancer, it may be HIV, it may be skin conditions, or it may be any type of conditions. You can get all types of cases directly flocking in our clinics. So that is because there is a strong bondage or a backbone or rules of Indian government, but which is not in West. So that is something very good, but we should take that responsibility and we should work in our frame of reference that the patient should not be bad by doing or not doing. We should give both the options, but the final authority is the patient and their relatives, not you. You should just tell them and leave them off. So this is the way I also do, because we cannot take much of responsibility. Our responsibility is give our best through treatment. But if they want to do something more better, they want to go for surgery, it is their option. You cannot stop them. Don't do surgery and I will treat. Forget it. Don't do that. Never should do that.
Okay, one more question from Dr. Amit. We have got a very excellent results in cancer by homeopathy, but we are always last preference. Why?
Already answered that.
They already answered that.
Yes. In cancer patient with homeopathic treatment, we continue allopathic immunosuppressant or taper them.
That also answered. I
Yeah.
think
Yes.
that is also answered. So I think then there is some delay in our show. So wonderful explanation, Dr. Hira sir. And here is your certificate from all of us from Delhi Homeopathic Medical Association and Homeopathic World Community. And we have Uta. She is the CEO of Homeopathic World Community. Uta, please say a few words.
Yes, I just unmuted myself. Thank you very much. A very interesting, fascinating webinar. Thank you very much to our two speakers. You've done a great job. And on behalf of HWC, I would say thank you very much, Dr. Deepak and the DHMA for making this possible. Thanks for the insights and wisdom shared. This was fascinating. For those of you who'd like to know more about HWC, I suggest you visit our website. That's homeopathyworldcommunity.com. And the calendar shows you all the events that we have coming up in the following months and the months after then. So thank you very much, Dr. Deepak, Hannah, Dr. Hira, thank you very much. And thank you very much for everyone who attended. It was a great webinar, very much learned. Thank you very much.
Thank you. And Marilyn is here. Marilyn. I think she's not there. Here is Dr. VP Singh, our patron of Delhi Homeopathic Medical Association. Sir, please say word of thanks to all of our participants and speakers. Dr. VP Singh.
Thank you, Dr. Deepak Sharma.
Sir, please unmute yourself.
First of all, I would like to thank to organizer and host of this seminar, and I will pray to God, may both the speakers may live long, and in the future they will teach us for more and more period. Thank you very much. Thank you.
Thank you so much. So stay connected with us. You can go to at www.dhma.in or www.homeopathyworldcommunity.com. So we are here to serve homeopathy and spread homeopathy all over the world. Yes, we will the first choice of treatment, but we need to go for a more struggle to spread this. Because we have much more things on cancer topic with the homeopathy, and this is the only science in the world who is connecting your mental state to your physical state. This is the only science. So we should thanks homeopathy that we are here, and we should promote all through this channel. So thank you everyone. Thank you Hannah. Thank you Dr. Hiralal Agarwal. Thank you, Uda. Thank you, Marilyn. And thank you all the team from SWC. And thank you, Dr. Shweta Singh. Thank you, Dr. Nupur. Thank you, Dr. Shakshi. Thank you, Dr. Garima, Dr. VP Singh, and our president. Thank you, everyone, to join us. Thank you, Richard, sir, also, because he's the person who concise all the duties. So thank you, sir. Please say a few words. Richard sir.
I enjoyed it. A lot of hard work went behind this. Nobody thought how hard it is to make this stuff. But great presentation from Hannah. I know she put a lot of work in it. And then Dr. Ira also. And of course, Dr. Deepak is top notch.
Thank you.
So everyone have a great day.
Thank you. So this is time to go. So namaste to all of you and goodbye.
Namaste.
Take care. Thank you.
Namaste. Thank you, everyone.
Bye.